Welcome to this episode of Think Again with Beyond Blue. I'm your host, Georgie Harmon. We're recording this podcast from Wurundjeri country, and we pay our respects to the traditional owners of these beautiful lands. This episode will take you through some of the basics of workplace mental health, including psychosocial hazards, with one of the leading figures in the field. Tony LaMontagne is a workplace mental health specialist with more than 4 decades experience. A Deakin University professor, he's described as the godfather of workplace mental health, advising governments, corporations and not-for-profits around the world, including the World Health Organization. And of course, more than 15 years ago, Tony contributed to Beyond Blue's pioneering work in workplace mental health. Tony, thanks for joining us. Tony, thank you so much for joining us.
My pleasure.
Now, Tony, we go back a way, but your relationship with Beyond Blue goes back even further, I think nearly 2 decades.
Yeah.
We've been leaders in workplace mental health for a long time, and dare I say it, you've been the godfather of our work. Is that okay?
Well, if you want to call me Tony, godfather, the patrone, but yes,
I think
that's true.
But you know, bringing experts like you into helping us shape our thinking, our work, how we approach businesses and workplaces, I think has really set us, you know, it was one of the magic ingredients from the start. So 11 years ago when I joined Beyond Blue, we were about to launch a major workplace initiative that was really trying to convince leaders to let us in, because we really struggled with that still.
Leaders to
let us in and actually talk about workplace mental health. And we did some research with PwC that's still cited today that showed the business case, the business benefit, the return on investment. Yeah. And that started to get the attention of boards and CEOs and decision makers. 11 years on, we're having to not, and I'm not complaining, it's the thing. It's, you know, people, boards, leadership teams are actually starting to really take this stuff seriously in ways that I don't think we've seen. Now, it's not perfect by any stretch of the imagination, and we're often focusing on wrong things. But when I think back to 20 years ago, 10 years ago, who would have imagined that we'd be here today? What do you think have been the biggest changes, and where do you think the biggest gaps still lie?
Ooh, yeah, that's a small question. But I think the attention currently is, there's a couple of things. One, the regulations have caught up. Yeah. And workplaces are like, oh, you mean we have to do this now? Some workplaces are on the front foot and engaged early on. Most workplaces need the nudge. And so that's a pretty big piece. And the other thing is, a lot of the workplace mental health trend, it's a positive thing. It's finally getting attention paid to it, starting mid-2000s. And it was all about workplace mental health. A lot of people thought, well, it's about people bringing their mental illness to work. Yeah. It's about, you know, accommodating people with mental illness in a sort of anti-discriminatory way and so on.
Tony, all of those years ago, 20 years ago, 11 years ago, 10 years ago, who would have thought we'd seen the changes that we have seen? I think there's a lot of a way to go, but what do you think have been the biggest changes that you've seen? And where do you think the biggest gaps still lie?
Well, I think the biggest changes recently, or in the last 5 years, regulations around controlling psychosocial hazards have come in across the country. Victoria is the last state to adopt it, but you know they're moving in this way too. So that has kind of swept the nation essentially, and now it's obligatory. It's not just you should or it would be nice to do this. You need to do this. It's your legal obligation. Yeah. So that's huge. And another piece is that initially in the early 2000s, when workplace mental health as a notion came in, not psychosocial hazard control, but workplace mental health, it kind of diluted the focus. And this isn't meaning to sound critical, but I think this was kind of in hindsight, an understandable phenomenon, where the focus went to mental illness. Yeah. It didn't go to, well, what is it about work that contributes to mental illness and could protect and promote mental health? And so psychosocial hazards got sort of pushed on the side. And most of what workplaces were doing, and these are really very valuable things, anti-discrimination programs, workplace mental health literacy, Are You OK days, and bring in EAPs and making sure that employee assistance programs were addressing mental health concerns as well as other concerns and doing it effectively and so on. That's all focused on comes from a mental illness perspective. And of course there are elements of that are preventative. When you promote mental health literacy and anti-stigma, you're creating an environment where people can voice mental health concerns, get help earlier when we know help is more effective, so on. But psychosocial hazards got kind of pushed, and it's a little bit, I would say, convenient for employers. That's a worker problem. That's not a work problem.
Yeah.
And so it's easy to fall into individualizing the problem. And so I think that was a huge part of it. And now that hasn't actually worked, the tide of mental health in the workplace, the prevalence of mental disorders, the claims, stress-related claims continue to rise. It's not working. And I think what was missing is a focus on work and improving the quality of work and addressing those aspects of work that we know are harmful, that increase the risk of depression, anxiety, burnout, suicide.
So many questions I want to ask you about what you just said. So I think your focus on how attention's turned to the individual, it's you. There's something wrong with you. You're flawed. You're not productive. Whatever. Highly problematic, because as we know, mental health is as much as the world around us is what's inside of us. So thank you for making that point. You talked a lot about psychosocial risks. Can you just explain for our listeners and people who are watching us what we actually mean by that?
Yeah. So from a work and health perspective, I come originally from an occupational health background. I'm an occupational epidemiologist. There's a mouthful.
Wow. Didn't know such a thing existed.
Yeah, you're looking at one. And so, we take the example that's all too well known in Australia, asbestos. So you're exposed to asbestos at work. You can get lung cancer, mesothelioma, asbestosis from it. There's an exposure and an outcome. And when you study the exposure and you see if it's associated with an increased risk in the outcome, you say, well, let's control the exposure. That's basic occupational health. So when we go in the workplace and we look at job insecurity, we look at low job control, we look at harassment, psychological harassment, physical, sexual harassment, all of these predict depression, anxiety, suicidality, so on. So it's the same basic approach to understanding how work can harm health. Now, there's a flip side to that too, which is good news, which is, when you have a high control job, that's challenging. That stimulates and that's protective of mental health, and it promotes well-being, right? So when you have good social support at work, it promotes a sense of belonging, and it also mitigates the effect of low control and high demands and things. So there are levers that you can work in a protective way in the workplace, and there are hazards from an OH&S perspective. It's all risk and deficit based. So we have to control the risk. We know that when people work and they're exposed to these things, you get an excess, you have preventable mental problems, mental health problems. So therefore, the usual occupational health logic is, well, control the risk. And so that's very important, but the OH&S perspective is very much deficit framed, negatively framed. It's all about risk and controlling risk, and it's mostly work focused, not mostly worker focused, right? And now it's true that if someone has a mental health problem and comes to work, that's going to affect work, whether it's work related or not. And it's important to attend to, there are individual dimensions to this problem too. But from an employer's perspective, what employers are required to do by law, and the policy ethos here in Australia is work should not be harmful to health. And that includes mental and physical health. Mental health was only added to the language a decade or so ago, psychological health or mental health. And that was quite an advance. But, why shouldn't it be? It's only logical.
Yeah.
The idea is you go to work, you come home to work, you're not harmed.
Yeah.
It'd be nice if you were even better off. Well, a lot of work is health promoting,
So you talk about good work.
Yep.
What does good work look like? So you talked about high control. Can you just expand on that a little bit more?
Good question. So most people like a little bit of challenge in their work. because when you're challenged a little bit, you're learning new things. You're expanding yourself.
Sorry to interrupt, but this is one of the furphies of psychological safety at work. It's psychological safety is not the absence of stress.
No.
Or stretch.
No, it's not. In fact,
it's actually just enough stress and stretch that it doesn't become harmful, right?
Yeah. So there is confusion out there in workplaces. Psychosocial health and safety is what we've talked about so far. That's, do you have what's your level of control in your job, the support you get, are you harassed or hopefully not, your level of security. Psychological safety is about whether in your workplace you feel comfortable to raise questions. Not necessarily say, everything's wrong here, but you have a voice and your voice is respected and heard. Doesn't mean everything you say is going to be acted upon.
Yes.
But if that's the ethos and the environment and the social environment in your workplace, that promotes self-efficacy. Like, oh, I had an insight here and actually it helped improve the way we do what we do. I'm okay, I'm good, I'm useful. And promoting self-efficacy promotes job engagement. Job engagement, you're a learning organization. You're using diversity, you're using everyone's insights, and drawing from all the available human capital, if you will, in your workplace in a learning organization. And that's synonymous with psychological safety. Now, it's true that in that context, you could be overworked, right? And so that's sort of but it's really about, that's part of a quality job, and I would put that under promoting the positive aspects of work. It's really positive culture, the culture word. What's culture? Well, it's a million things to a million people, but I think everyone has a sense that it's a place you would like to work. It's a place that doesn't tend to lose their workers. It's a place where people grow, where people develop. They get great satisfaction out of that. Job satisfaction, life satisfaction. That's a health promoting job. So in a good job, you've got challenge, because do the widget, put the thing on the assembly plant over and over again. You're not learning a lot. Some jobs that's the way it is. But if you're in a role where you have some control over what you do, how do you do your job? How do you define your tasks? Simple. I remember one interview study with a receptionist, and this receptionist had, tell us about your job. I take the calls, I greet people, I do the copying, got errands to do, I got to juggle all these things, but I've got this manager who wants to micromanage me and tell me what order to do it in. I'm not an idiot. Just let me do it. I can do it much more effectively than her hanging over my head telling me, no, do it this way. So micromanagement is a classic thing. When you give people a little latitude, and sure, you got to be sure as the manager that latitude is going in the right direction, the person is doing a good thing. Most often they will. Yeah. And that builds trust and mutual respect. And especially the lower down the occupational status ladder you go, the more important respect and dignity are. Those are fundamentals in a workplace. So, you want a manageable workload, you want a bit of challenge, you want the latitude to do it in a way that you're contributing, and you can take advice, and you need the right support to get the job done, whether the support's human, supervisory, the equipment you have, the environment you're in, and those things produce health promoting work.
And we've not once talked about services.
What do you mean by services?
In the sense of a lot of workplaces think, we've got that covered. We've got an EAP.
Oh, right.
I've got I've got support pathways, really important.
Yeah.
But, we often talk at Beyond Blue about the 5 in 5, not the 1 in 5. 1 in 5 Australian workers will come to work with some kind of mental health challenge issue.
Yeah.
Design a workplace mental health strategy, think about psychosocial hazards for the 5 in 5, and everybody does better.
Yeah, absolutely.
Yeah.
Absolutely.
So
this is that classic thing from this old guy, 1950s, 60s, Hertzberg, who said, if you want people to do a good job, give them a good job to do. It's
love
beautiful.
that.
I love that.
Yeah, it's so
it's
simple.
It's a great phrase. And a good job, we just talked about what a good job is.
Yeah.
A good job is challenging.
Yeah.
And this is not to say that you should go easy on people and all of this, because some people overinterpret. Oh, so now we have to make sure everybody's happy all the time. Well, no, you don't. Some of the positive stuff in the workplace can seem a little patronizing. I remember passing a 100 smiles an hour zone sign on a wall in a workplace once, and I thought, oh, maybe I should tear that down. But because it's patronizing,
exactly.
And it's lovely when people are happy at work. It's not about happiness; it's about contentment, dignity, and respect.
Yeah.
Anyway, so we.
No. Beautifully put. And when we talk about psychosocial risks, we talk about what the evidence shows are the biggest drivers of workplace stressors, and which can lead to psychosocial hazards. What are the most common? So again, someone who's listening to this going, these are really big words, I don't understand.
Yeah.
What do team leaders, managers, leaders, workers, colleagues need to look out for? What are and work towards eliminating?
So the biggies, and these would be the things that are measured in psychosocial hazard risk assessment, which is what's now regulated, and a lot of workplaces are scrambling to formally do psychosocial hazard risk assessment. So you use like a questionnaire, and they ask about, these are the biggies. Job control.
Yeah.
So job control is about how much latitude do you have to decide how to do your job. It's not saying you can do less or whatever. It's like, do you get some input into how you do it? And that is protective and promotes well-being as well as preventing harm. The other aspect of job control is called skill discretion. And what it says is the more skills you need to apply in a job, the more protective it is and health promoting it is. And so, the ideal job is, you've heard of probably the phrase job enrichment.
Yes.
That means mixing it up a little bit.
Yeah.
Completely monotonous work, surprise, surprise, not so good for mental health. So mixing up a little bit, a diversity of tasks, using a diversity of skills, maybe some technical skills, some people skills, to get your job done. Then you have a more rich job, and that's job control. Demands of the job, of course, are key. This is a constant refrain you see in common parlance, in workplaces, in the surveys and all, is workload.
Yes.
Now, a colleague of mine in business school up in New South Wales, Mike Quinlan, he said, I can summarize all the management theories for you in 3 words: more with less. That's been the trend. Everyone is monitored more and more, squeezed more and more, and at the same time, you're given less and less support to do it. So if you look at the productivity discussion that's coming up now nationally, the investment of workplaces in the training of their workers and the development of their workers falling away. And then, of course, we have the rising, it's pretty steady now, I think at around a quarter of the working population is precariously employed. Employers don't tend to invest much of anything in them beyond what they absolutely have to, because they're disposable, frankly. And that's really a problem.
So
precarious work is harmful to mental health as well as associated with a lot of other problems.
Sure.
So we're coming back to the big hazards, psychosocial hazards. So that's control and demand. Those are 2 really big ones. And when you have a job that has low control and high demands, it's sort of like having your hands tied behind your back, and that's particularly harmful. That roughly doubles the risk of depression.
Wow, okay.
And that affects about a fifth of the working population.
Yeah.
Women more than men, because job control is still gendered, where men, even in the same job, tend to have higher control, persisting sexism in the workplace, essentially. And so that when you combine that increase in risk with how common the exposure is, you can do this with epidemiology. We can say that about 15% of depression in the working population could be, in theory, eliminated if job strain were eliminated.
Goodness.
So, and then when you combine some of the other prevalent hazards, job insecurity is another biggie and quite harmful to mental health. Lower prevalence, 5% or so of the population usually feel insecurity acutely. And you have harassment in various forms, bullying, sexual harassment, and so on. But a colleague in France did a Europe-wide study and estimated similar, so that figure I gave a minute ago, 15% being attributable of depression being attributable to job strain. She looked at job strain, bullying, job insecurity, and one other. And that's up to a third of prevalent depression is, in theory, preventable by addressing those problems. So, would we ever get to that huge of a chunk? I don't know. But the point is, it's not a small problem. No. And sadly, as much as the workers' comp system is straining and claims continue to rise and get longer and more expensive, it's only getting the tip of the iceberg.
So what would you say to the business owner that says, that's all very interesting, but that's really not my problem? I've got shareholder needs to meet. Head office is saying I have to do more with less.
Yeah. And this is a toughie because, this is, that same business owner probably isn't going to be swayed by the fact, well, actually the law says you're not supposed to harm people at work. You are harming people. And if and when you were to be inspected, you would need to say, well, I have assessed risks and I did identify these risks. And this is what we put in place to mitigate those risks. And, it's not a perfect world, and the legislation recognizes that. It's you do what you can to the extent practicable.
Yes.
So cops will always get shot at. That's a very sad thing, right? But that's not something you're going to eliminate. So you have to come down a little bit and mitigate those impacts. Maybe limit the amount of time cops get exposed on the beat. Whatever, this kind of thing. Some aspects of work. People work with traumatized, care workers working with victims of domestic violence and so on. Vicarious trauma, very big deal. Can you eliminate that? No, you cannot. So you've got to come up with strategies to mitigate the effects of that vicarious trauma on the care worker, on the lawyer, on the, whatever. There's many people exposed to these things in their occupations. So for example, you see that the impact in particular of exposure to trauma on AMBOs and paramedics is they really stick out in the excess suicide risk category. Repeated exposure to trauma, you can there are things you can do to try to mitigate it, but at the same time it's probably the case if we really want to deal with that, we'd probably have to limit the amount of trauma exposure people are currently experiencing, and that means redesigning the job. That's hard. But so is being depressed, and suicide is very hard on that person, wouldn't you know? So we're actually, we currently, I would say, do not see the burden of poorly designed work on the population. It's there, we've documented it, but people kind of don't want to see it because it's very hard to fix. So it's really a societal question. What kind of society do we want to be? So that's probably not the most compelling argument for that employer person, that fictitious employer person that you just proposed. But that's the way I see it.
I met with someone earlier today who's a very senior person who said you don't want to be that business person where someone dies.
Right.
And, we often talk about, occupational health and safety, but, suicide risk, and you talked about police and emergency services just then. You do not want to be that. That changes your life. It changes your leadership. It changes everything. You don't want to learn that lesson. And I often talk about humanity at work. I think, ultimately workplaces are communities. And we try and design for to meet the regulation, and sometimes I think in that we lose our humanity, and we actually think we design systems instead of actually sitting down with the science, with the research, with the evidence, and saying to our people, what's actually what does good look like? What is going to make the biggest difference to your well-being in this workplace, knowing that there are going to be limits to what we can do when it comes to how you work, what you work on.
I mean, that limits question is a real one because, well-designed work probably is going to cost some resource.
You don't want to be that leader where someone dies on your watch, someone dies under your locus of control. We often talk about, physical deaths at work or deaths caused by injury, but suicide is a real thing. It happens every day, and it changes the course of your leadership. It changes the course of your life sometimes.
Yeah.
You don't want to be that person.
No, you certainly do not want to be, but preventing that from happening in your workplace, to the extent that you as a leader, what you can control is how much that work is contributing to that risk, to that suicide risk, to that depression risk, anxiety, burnout, whatever the case may be. And that's your role as the responsible leader. And then responding to that death in a workplace from a traumatic fatality or from a suicide, and the suicide at work may be work-related or not.
Yes,
right?
Exactly.
But still, you have to respond in the same way. Someone manifests with a mental health problem at work, you're obliged to respond, and you're obliged to respond in a timely, non-discriminatory way. And that comes in, that's regulatory response coming in, or requirements coming in from anti-discrimination law, employment law, and so on. And so you need to be able to both prevent that from happening to the extent feasible through work, and you have to respond when it happens, regardless of cause.
Yes.
And those are those are the protect and respond arms of the integrated approach. And if you're promoting the positive as well, then you're reinforcing everything else you're doing, and you have better preventive potential.
So you mentioned the integrated model, and it's a kind of tripod, isn't it? So can you explain what that means?
Yeah. So the integrated approach to mental health grew out of working in the field. And so, in fact, one of my first trials was a Beyond Blue funded trial in a window factory in the Dandenongs.
Wow.
This is about 15 years ago. Yeah. And when I would go in these workplaces, I would have way too much to say and way too much to, because it's a complicated topic. So we put ourselves a challenge, like, how are we going to distill this down and get to the point? So sometimes you'd be talking to a very sympathetic employer, health and safety or well-being or HR person. It's like, okay, we're on board. Just tell us what you're asking us to do. I'd be like, oh.
Yeah.
And so we put our heads together, a bunch of us working around this, and we came up with the integrated approach. What we want you to do is protect people from harm, promote the positive aspects of work, and respond when people show signs of distress.
Simple.
Now, sounds simple. It's great elevator pitch. No jargon. Jargon-free was the requirement. Took us a while. We do speak too much jargon. And so protecting from harm means that's where the psychosocial hazard bit's coming in. As a workplace, in theory, you're providing work that is safe for physical and psychological health. And that means knowing, if your demands are reasonable, if the person is adequately supported to get the job done without getting stressed, these sorts of things. It's consonant with good management, really. And the promote the positive bit is, people like to have good workplaces where people want to work. And promoting the positive aspects of work is, what about how people support each other at work? Instrumentally, that is, helping each other get their jobs done. Emotionally, helping each other when the front of house person is stressed out by a nasty client, for example. So that social support can take various forms, and it's the glue. Social connection, we know, is fantastic, and its opposite now of loneliness has surfaced as a huge problem for mental health, including in workers, especially workers who work alone. But in the general community, as you know, it's a huge phenomenon. And so that's sort of the protect and the promote aspect. The promote aspect can also be, look, we've got somebody who's doing a particular job. If the manager had time, checking in with people is normal management practice. It's like, oh, so how's it going? So the way you do that, does that seem to work for you? Can you see a different way to do that? Or is there a better way to do that? Oh, yeah, well, I think we could do it this way. And actually what I really like about this job is this bit, not so much that bit. And if, as a manager, you're able to give the worker more of the bit that they like, you're promoting their job engagement and their productivity. And so promoting the positive reinforces the protect arm. The third arm is respond. When people show signs of distress, you got to respond, regardless of whether it's work-related or otherwise. And you should respond in a non-discriminatory way that's timely. Timely is a tricky bit, you know. Getting in early when people are, when they're, short of a crisis is much more effective. The supports we have available are much more effective the earlier you intervene. But of course, you have to balance that with privacy and, sometimes it might be a performance problem, sometimes it might be a mental health problem. This is a challenge for managers. And this was the focus of Beyond Blue's workplace training. In the first iteration of that, going back 20 years, was a 1-hour awareness training and some skills around help offering for the general staff, and then a half-day training for managers, because you've got to be mindful of your job as a manager is not to treat someone or diagnose someone. Your job as a manager is to help that person to get their job done to the extent feasible. We've talked through the protect, promote, respond, the three arms of the integrated approach. And so what does it look like in a workplace? Well, some strategies, it's a variety of strategies. The protect arm, the place you got to start is assess psychosocial hazard risks. That's the regs and so on. And then you learn from that. The hard bit is then what do you do with that information? Well, people are concerned about their workloads. Well, how are we going to fix that? Well, you might have to redesign the work. You might have to hire more staff, or you might have to create a dynamic system that shifts the workload as it comes in so that you're spreading it more evenly and you're not stressing out individuals in Department X, this kind of thing. So risk management is the hard bit. And there's no unique solution to that. There's no off-the-shelf solutions, I should say. And then with the promoting the positive, there's a lot of focus on resilience programs and all that are usually individual oriented.
Yes.
And there's value in that.
Yeah.
There's value in improving my or your ability to withstand stressors. That's sort of resilience. But organizational resilience is another thing. So
and team resilience.
Team resilience, exactly. So, you deal with problem solving by drawing on a team. Go to your broader team, or where you have peak demands coming and going. You develop a system that you back up your staffing at certain times of year or whatever your business cycle is, such that when you get a spike in demand, you can bring people in or divert people from another part of the organization so that you're not overly stressing those workers there, and you're more timely delivering that service or product to your client base, which is good for your business.
Yeah.
So that organizational or team resilience is much more, and when you do that, that means people are better able to succeed in their job. So that promotes self-efficacy, that promotes job engagement, that promotes job satisfaction. All of those things are higher productivity. So that's kind of like that's an illustration of the promote side. And then the respond bit it's kind of huge there. So respond is everything from, oh, you don't seem to be yourself today. Is everything okay? Just a little informal check-in, and are you okay day is a common, operationalization of that, if you will. That's valuable. That's a collegial workplace. That's at the very sort of mild end. This could be all the way up to, what do you do in your workplace if somebody has a suicidal crisis? Well, having a mental health first aider or somebody who's had a SIS training, that's applied suicide intervention skills training, such as the MATES and construction program does. Those people, just like having a physical first aider in the workplace, you have a mental health first aider in the workplace, and that's your organizational capacity to respond in that circumstance. Very rare, hopefully, but an organization that's thinking ahead can anticipate and do this and train people up, just like people get first aid training. So some things that people do can span all three: protect, promote, and respond. So really well-designed peer support program is providing social support, and that mitigates the impacts of high demands and low control. It promotes social connection and a sense of belonging through, again, that peer support and looking out for one another. And then third, obviously, what it's best known for is that's the peer responds when somebody has a problem. Well, if it's done well, it's actually covering all three. You know? And so for any given strategy, the more of the three pillars it addresses, the better.
Yes.
You know? And so a large organization might have a whole raft of different programs or strategies, from risk assessment to Are You OK Days to EAPs and you know, training up mental health first aiders and so on. And a small organization could do the same in a more informal way. And so that's a rapid tour of the integrated approach.
And I think that's that last point you make is really important, Tony, because it can feel overwhelming, I think. Especially the smaller business you are. It's like, I don't have an HR department,
yeah,
right?
That's right.
It's me. So where do I start? And I think, you know, again, just, you know, sitting down, thinking about your business. You know your business more than anybody else.
Yeah.
Talking to your team if you have one, and just actually thinking about, you know, asking those questions. What does good look like? Like, let's not hurt each other. Let's not be nasty to each other. Let's actually talk about how we work, flexibility. Let's make sure that we have a kind of culture where people can actually be curious, can speak up, and can ask for help and offer support.
Yeah. And many small businesses they do have kind of a family feel, maybe literally a family or not.
Yes.
But yeah, of course we look after our people. Yeah. And so we did an exercise in sort of translating this wisdom of the integrated approach. Did a hypothetical conversation with a small business owner. You know? And it started out by saying, well, what do you do to look after your people? Oh, well, you know, Susie likes this part of the work, and so she does most of that. There's job crafting. We monitor, look, you know, when we have these peak periods and we shuffle things around, or, you know, that's protecting from harm. And, you know, if somebody has a problem, we cut them some slack. There's respond. So, you know, it's sort of, and it's very informal, and you can just build from that. You go, well, you're already doing it. Oh, really? Yeah, you are.
Yeah.
You know, and so intelligent questioning will sort of make them realize that if you're a caring employer, a reasonable employer, you're doing a lot of it already.
I think a lot of people will be really comforted by that.
Yeah.
Because I think it feels big and scary.
Yeah, sure.
And it feels like, you know, especially obviously with the much needed regulations that have come in, you know, it can feel overwhelming, and
sure can.
It can scare people into seeing this just as a risk to be managed, as opposed to an opportunity to create a workplace community where difference is celebrated, good work is done, people work hard because they actually enjoy the company of the people they're working with.
And you get great satisfaction, they take home pride in their work.
Exactly, yeah.
Huge. Yeah.
Okay, this is the big question, Tony.
I'm bracing myself.
We are having a conversation, I think globally, but certainly in Australia, about productivity.
Yes.
You know, it is a conversation that is really necessary, but I fear that we're not having as nuanced as a conversation as we need to.
Yeah.
What's the relationship? And we've touched on this, but let's kind of get down to tin tacks here. How does mental health and well-being, a psychologically safe workplace, how does that contribute to productivity? What's the relationship, and what's your fix?
Okay. Well, I think right now there's a huge preventable burden of mental ill health because of work right now. So if that isn't hurting productivity, I don't know what would be, right? If up to a third of prevalent depression could be prevented by improving the psychosocial quality of work, then in theory, what are we waiting for? So that's point number one. That's the elephant in the room. Maybe it's because it's bad work that we're not productive, you know? And so that's a little bit simplistic to say, but what has to be recognized first is that poorly designed work is hurting a lot of people right now. and that's being externalized onto the worker. And so that's a huge problem. In discussing the integrated approach, we've talked about that promoting the positive element. Well, one, if you keep people well, they're going to be more productive. That's sort of protect. And when they do have issues, responding to the extent feasible is quite important. And it's the promote bit. Most workplaces want to have a positive culture. And a positive culture is a productive culture. I don't think we need to convince people of that. And so to the extent that you can give people good work to do, they'll do good work. We're overusing the quote now. It's the second time it came up. But, from Hertzberg in the 1950s, if you want someone to do a good job, give them a good job to do. And if they have a good job and they're doing well at it, that's productivity. So that maybe I'm staying too high a level, but it would be attending to the quality of work that we offer in terms of promoting well-being as well as protecting mental health. The risk focus, the regulatory focus is preventing harm. That's all well and good. That's part of productivity too. But the sweeter spot would be thriving, giving people jobs that are challenging, that bring out the best in people, and then you'll get your optimal productivity.
Tony LaMontagne, it has been an absolute delight talking to you. You are the godfather. We're very grateful for your wisdom today, and thank you so much.
It's my pleasure. It's been great working with Beyond Blue, and may the show go on. Thanks, Georgie.
Thanks for tuning in to Think Again with Beyond Blue, giving you a fresh take on the big questions in mental health and wellbeing in Australia. You can write and review us and find more episodes wherever you get your podcasts. And if this discussion has raised any issues for you, don't forget the Beyond Blue support service is available 24/7, free of charge, on 1300 22 46 36, or visit our website.